Well, hi everyone. Thank you for still being awake this long after lunch. I appreciate it. Before I get started, I just wanted to say thank you to Amy and everybody who's presented so far. It is absolutely wonderful to be in a room where every single person is presenting and they get it. Are all of you having that same feeling? It's not every day that we're surrounded by people where we get that feeling over and over again, and it's far too common that we're surrounded by people where we say, I really wish they got it. So thank you for this day to Amy and your team. So my name is Julie Lago. I am the founder and lead consultant at Connections Always. Is this the clicker right here? Mm-hmm. All right, sounds good. And I am also the newest executive director at the National Center for START Services. I also, because I love working, so I have been adjunct faculty in the social work department at UNH for several years, so I would love only just be lucky enough to have Rachel at some point in one of my classes. So today we're going to talk about the importance of wraparound care for children and families. How many of you love silos? Anybody? Anybody like to repeat your story? No? No. I have a tagline of decrease redundancy, improve efficiency. However, today I have never been so grateful for messages that have repeated themselves over and over and over again. So as I'm going to present today, a lot of what I'm going to present has already been said. And that's okay, because some of these things we need to hear again and again, and we need to share those messages again and again. You expect that I'm going to stand here and tell you about all of my experience, right? Because that's what we do. We make assumptions. Why are we here? What are we going to talk about? I can stand here and tell you about my several years of professional experience, and I can tell you about where I teach and what I've done and where I've graduated from. And yes, I'm a licensed independent clinical social worker. That's important. I'm very proud of that. I can tell you that I've worked in community mental health and go on and on and on. But that doesn't tell you who I am. And when we talk about wraparound teams, can we wrap around a child or an adult? Can we wrap around anybody without understanding who they are and why they're there? Let's get rid of the assumptions. So this is my why. And this is me on a Saturday. And it's not that picture. And that's okay. This is my why. I don't work in the disability field because it sounded like so much fun. I worked in the disability field out of necessity because gaps exist. Because these are my loved ones. These are my best friends from childhood. This is my cousin. And this is my friend Joey. And Joey, Taisha, Astrid, Ingrid, and Ronnie, who were siblings, we all went to school together. And how lucky was I to have friends like that. And we had very real life experiences. Now, in that picture, that's my dad. My dad's my mentor. And he showed me the importance of modeling in every single thing we do. It's how we speak to people. It's our body language. It's about how excited we get to see people in a very genuine way. And when we look at this, my why is because I don't want a world where they can't access things that I want a world where they can access every single thing that I can. But there was a time in our lives where everybody on this screen had we all had some pretty significant trauma together in one single year. And that impacts your mental health. That's why I became a social worker. I was offered therapy. I was offered a trauma response team from the state of Massachusetts. And even though the events hit them directly, all of them, I was offered services, clinical services, and they weren't. Why? Because they had a disability. Nobody thought of that. So here swoops in social worker, right? And that's my why. My why is also to model for these two little girls, because they're the next generation. And that's why we need wraparound teams, is to share the message so we don't have to repeat it over and over and over again. So here are some of our goals for today. We don't have very long, so I'm not going to read through them. I'm going to just keep us going. Every single one of us in the room has worn one of these 1 or a million times, correct? Okay. I'm going to ask you to shout out what profession you work in or why or what your role is. So I've heard OT, I've heard social work. What other? What was that? Speech. Speech. Yay. What else do we have? Who else do we have? PT.
Parent advocates.
Parent.
Preschool teacher.
Teachers. Mental health.
Public history.
Public history. Love it.
Child life specialist.
Okay. Child life specialist.
Family support.
Family support. Okay. Did anybody keep count of those? Because we could keep going and going and going. But for every person in this room that wears a different hat, so I want you to think about it. It's not just the role you play, but when you sit at a table, we all wear different hats. We hear information and we retain that information in different ways based off of our personal experience, our life experience, our trauma, our professional experience. So when somebody, wow, oh, we're going way back, right, there it is. So when people introduce themselves, our children, or any of those that we support, hello, my name is can be heard in very different ways based off of the hat that you wear. Are you hearing it from the mental health perspective and saying, oh, well, I assume this is why they're here? Or if you're an educator, you're automatically assessing for what their education needs are. Or you assume that they're there because they want to learn or are being forced to learn or something's going on, right? We all make assumptions right away. So, the power of hello, my name is to ask and dig deeper. This is how we start to get wraparound care for children and families. We look past literally the label and we start to ask more questions. So hello, my name is Julie. Now let's go back for a second. That's what you expected, or maybe it's probably what you should have expected when I'm standing in front of this room. But if you ask a little bit more, it leads to the same information, but it tells you my why. And it's going to help you understand how to wrap around me. What motivates me? What keeps me going? What's my history? What are the things that I wake up in the morning and I say, today's a tough day and we have work to do. So as we're building teams, we have to focus on team education and buy-in. What are your first, and by the way, if you thought you were going to just sit here and kind of hang out with me, I do make I make you participate a little bit. So just shout it out at this point. Team education and buy-in. What are the first thoughts you have when you think about teams? People working together. Now remember, we talked about I have to introduce myself here, to OT, and then I have to introduce myself to PT, and then speech, and then primary care, and then mental health, and then education. What does it feel like with the idea of those teams possibly working together, or crazy, but maybe same page, same team? What's your reaction?
Vision,
Vision.
having the same vision.
Yeah. So anybody say not a chance? It's okay. Does it seem daunting? What do you think it would take to get buy-in to create a team?
Equal value of members.
Equal value of members. Yeah. What else would it take? Sure.
Human connection?
Human connection. A desire to be there. Maybe a mutual respect. Perfect.
Common goal.
Common goal. Absolutely.
Trust.
Trust. How do we develop trust? Especially when there are that many hats. Time.
Communication, yeah.
Communication just came from both sides of the room. Wow.
And
So-
collaboration too.
Collaboration.
Honesty.
Honesty. Sounds like you guys have thought about this before. What prevents us from getting there? Egos. Everybody, a bunch of people said egos first at once, like you were all synchronized.
And also systems.
Schedules. Assumptions. Because automatically we assume why people are there. Well, they must be here because, and we make assumptions based on the hats we wear. But if we can step outside of our own scope of practice and start looking and build education amongst teams versus staying in our silos, naturally we're going to have more buy-in. Has anybody in this room had experience with something like that, where maybe you work in an area where you've seen, okay, can you tell us a little bit about it?
Sure. So I work at Reach for the Top as a speech language pathologist, and some of my greatest sessions are the parent, the child, the PT, the OT, and we are all there working with a client together. They're actually me and Miss Kat. We all have a shared client, and we all come together to meet the needs, whether it's positioning, transport, sensory input. I'm there with the communication device, helping this child communicate. Are they going to crawl? Are they going to kneel? Are they going to walk? And giving them the independence to make that choice. And it's a really cool session to see all of those roles coming together.
What would happen if you had to do that independently?
I wouldn't be able to get the sensory input that kid needed. I wouldn't be able to physically know how to move them onto a swing. I wouldn't, be able to give that education to the parent to answer some of their questions.
So it sounds like what you're saying is that we might need to create a norm or start developing an expectation versus the exception, novel concept, right? Of creating person-centered, team-supported care. I developed a model called bookends therapy, and I have information out in the front about it. And bookends is all about person-centered, team-supported care. Paying attention not only to what we think our children or adults that we're supporting need, but asking them. And if they can communicate that, that's wonderful. If they can communicate that verbally, if they can communicate that otherwise, or if we take the time to observe and see what they are communicating, because they're communicating something. But if we can get away from that assumption and have what they are communicating to us as to what their needs are be what is driving our interventions. Not from our silos, but from a team-based model. And letting them provide the education. Oh, we're moving real fast. We're moving fast. And letting them provide the education to their providers. What is it they need? Show me. Tell me. What did you just learn? They come into one of your therapy sessions, and the parent comes in at the end, and rather than you showing them, what would happen if, and maybe you do this, they show them, hey, show off a little bit. Like that little nudge of, this is your time to celebrate. And that's how we get buy-in. It's providing not only getting team education from the multidisciplinary standpoint, but allowing those that we support to be at the forefront of the education that's being provided. So often we're talking for them, we're doing for them, we're encouraging them, but are we giving them the opportunity to provide the education to their team themselves? And then celebrating those successes, or looking at the discrepancies and then supporting along the way. Now, we do not have a ton of time left, but this is a really, really important exercise. And I'm realizing these pieces of paper look very small in this room. They look very small in this room. Thank you for the Venn diagram, Rachel. My brain works in Venn diagrams. So what we're going to do just very, very, very quickly is we're going to look at a Venn diagram and come up with it together. But this is creating a team-supported model, how to bring teams together. Now, I gave the example of mental health and occupational therapy, because as a social worker, I just came from 13 years in community mental health. I can tell you that my work is so much better when I have an OT on my team. And I see people that have been on my team going, yeah, yes. Okay, so let's talk about what is provided in what we gather or what we look for in mental health services. So for those of you that might either be in that field or have participated, what are some of the things that we support in mental health services?
Learning coping skills.
Coping skills, yep.
Well-being.
Okay, well-being. A lot of assessments, right? We're trying to gauge where people are at. So I'm going to call them, we could do the PHQ and the GAD, their depression and anxiety scales. You can write it however you want over there. In mental health services, do they always ask you what your goal is? Have you ever had anybody ask you what your goal is? Well, if they haven't, let me ask you, they're writing down what your goal is. So if they didn't ask you, that's a problem, right? But most often the goal is to feel better. If I didn't want to feel better, I wouldn't be here. What do you mean, what is my goal? Well, what does that look like, right? So in mental health, a lot of times we have goals and objectives. What else am I missing, Suzanne? I heard you.
Processing trauma.
So trauma? Yep.
Med management.
Okay. Yep. Perfect. All right, let's skip over to OT for a minute. What kind of things are the OTs in the room or the therapists in the room addressing? We'll give this example.
All of them.
All? Yeah, no. Just happened to work like that.
Sensory.
All right. So in OT, I'm gonna start it off. First thing you do is ask what their desired occupations are, right? So, goal occupations. What else do we have? What else are you looking at?
Self-care and ADLs.
ADLs and self-care. What else?
Sensory processing.
Okay. Keep throwing it at me.
Meaningful and purposeful.
Okay. So meaning. Okay. What else do we have?
Vision.
Vision. Okay. Okay. Any assessments? Constant assessments?
Yep.
Yeah. Measurable. Everything has to be measurable and attainable. Okay? So we're going to say, so measures. Okay. All right, let's stop here because I'm going to run out of time. And by the way, I do similar presentations for full days, so a half hour. We're doing really well. All right. Over there, we called it the secret sauce in the middle. Over here, we're calling it the magic. I don't really care what you call it. Just make it work for the person, right? Let's talk about the whole person approach. People are people, humans are humans. I can't have mental health and OT standing alone. And I told you I was going to be repetitive because everybody already checked all my slides off the list. So thank you. So let's bring it together. If we're going to have whole person care, if we're going to work to bring teams together to be more efficient, not only more efficient, but more focused. Hello, my name is Julie and I experience X, Y, Z. Not, hello, my name is Julie and I'm here for. So let's bring it together. How are we going to do this? So if we connect the dots, goals, we have goals over here, we have goals over here. Should we potentially have similar or if not the same goals and maybe different objectives? Because the reality is, if I have goal occupations that I want to achieve, which I had a person I worked with who said that she went to art school and she was diagnosed with major depressive disorder. She hadn't left her house in a very, very long time, and she met criteria for severe persistent mental illness. When we brought our OT in, we found out that she went to art school, college, and had her degree. She had a medical condition that prevented her from painting, her favorite thing in the world. The minute we brought the OT in, she was able to modify the grip on a paintbrush. That individual was then able to start painting again slowly. And what we then saw were that her measures, her PHQ and her GAD, so her depression and anxiety score started to change because she got the meaning back. She started to take her medications as prescribed because she had a reason to. And the trauma that she experienced, well, she had more reason to start to work with her team on that because she was more willing to leave the house. And we had an art therapy group, and she could participate now. Fast forward a few months, she was participating in one of we actually had an art gallery that went up, and that was pretty exciting. So when we take the goal and we merge our goals and we share, and we merge our goals and we say different objectives, we're going to work on it from the mental health side, but you tackle that OT. You change the grip, you make sure that these things are accessible. Is somebody able to empty their dishwasher? Well, often we're judging people, and it is judgment. Well, they're so depressed that, they can't even clean their house. Or do they not have the skills? And if they had the skills from the whole team approach, maybe they wouldn't be so depressed. All right, I'm going to let us move on from that. Thank you so much. All right, so self-determination. How am I doing for time over there? I saw a sign.
You have 5.5 minutes.
All right, let's do this. Speedy. So self-determination. We have to get to the point where people believe they can. The only way they are going to believe they can is if we believe they can. And we have to believe they can consistently. We have to believe they can as a cohesive team that has strong communication, and we have to prioritize team culture. One person can throw off the whole team culture. So as you look at your why, and please do, it's so important, but as you go back to your organizations, your family, wherever you may be going after this, please consider your group why. Because without cohesion, it will impact the culture. And culture is priority to ensuring that we're all on the same page towards self-determination. So, if we identify your why and discover your how, I told you I really like Venn diagrams. You'll achieve a positive and cohesive team culture, improve communication, develop expectations of care. We need to stop with making things the exception. Oh, that's so wonderful that Reach does that. No, it is wonderful that Reach does it. Don't get me wrong, you guys are great. But why aren't we all doing that? And why aren't we saying it's okay to create the expectation and to set expectations? Prioritizing person-centered outcomes, building from strengths, fostering growth, and building your dream team along the way. In my world, a dream team starts with the individual at the head of the table. The person who is in services is the boss. What do they want? What works for them? What are their strengths? And let's get more of that. Because if I am only focusing on what's going wrong, I have missed everything. We're going to do this by engagement and modeling. So I am a New Hampshire leadership Inland grad. So if I did not mention the least dangerous assumption in my presentation, right, Deb, then I would be in trouble. Yeah. So, and so here we are 15 years later, Deb, and it's right here. So you can tell everybody. So the least dangerous assumption, we have to presume competence. Assume that people can. Assume they can understand you. My friends Astrid, Ingrid, and Ronnie were all born with the same genetic condition. When I met them, they were walking, they were talking, and nobody knew they had a disability until things started to change. And then people started talking to them differently. And people started to crouch down, and then the voices got softer. And then, she's bilingual and she's smarter than you, you stand up, let's go, right? And it's all with the best of intentions. But what was it making my friends feel like when they said, I get it, hi, it's that idea of, hi, I'm here. Hello, my name is. And we have to remember that that people don't always know to presume competence. And so it can be with the best of intentions, and we can provide education and modeling, encouragement and modeling in respectful ways, and also understand that people are trying to be, they're trying to be kind, but engagement and modeling are what's going to help us to create a more inclusive community. Identify strengths and successes to support goal identification. Strengths first, and we just talked about that. Utilize reflection and skills to support an individual's learning, processing, and communication needs. One size doesn't fit all. 1 minute, I got this. One size doesn't fit all. So for what you do for one person isn't going to work for everybody. Ask people what they need. Observe what they need. Speak to their families, and then observe what they need. Discrepancies are okay. Challenge that. Challenge what you're seeing. Have discussions. If we just accept everything that we're hearing, but we're not paying attention to what we're seeing, and we're not having communication amongst the teams we're building, we're not going to help people make progress. So building, again, that positive culture so you can have those discussions. And to wrap up, so person-centered care, I'm going to move forward because we have been through this. And by doing this, we are going to create this beautiful cycle, right? This beautiful circle where everything connects. I can help people achieve their hopes and dreams if I understand their physical health needs, who their supports are, their mental health needs, their strengths and their interests. But if there's a missing piece to this, are we going to help them not only find and get to their hopes and dreams, but stay and really sustain their hopes and dreams? And this is my last slide. So our goal is to build team confidence. A confident team is willing to gain insight and not think, I know it all. But they're willing to listen. They're willing to work together. We want to foster a team-based, person-centered approach, build relationship and rapport, take the time, send the thank you card, check in on somebody after and just say, hey, doing okay? It goes a long way. Take the time to reflect what went well and what can go better. Again, address discrepancies, provide education and clarity and validation in real time. Don't sit on things. Let's have open discussions. So often we stay away from those things, and it prevents us to working cohesively as a team because people are sitting there, and then just like today, I'm sitting watching Michael and I'm going, oh, me too, me too, me too, right? It's important. Validation and getting to know your community, you're only going to get to find your people if you put the effort and you put the words out there. So be willing to do that. And create active solution-focused planning. Let's be working on something, not over and over and over again. So we don't have a ton of time to chat. But what I will tell you is that I would love to connect with all of you. I have information out there to connect. I also put flyers out, and I forgot to mention it. I run the Able so you mentioned Able New Hampshire. I run the Able New Hampshire Mental Health Task Force, and I did put the pamphlets for all of the task forces that they run out in the hallway. But we are currently doing a mental health series in the evenings once a month, and our current focus is taking care of your mental health during times of uncertainty. You guys don't know what I'm talking about at all, right? So please feel free to check out that information and join us, or feel free to get in touch with me.